Yeah.
intercollegiate quiz conducted by the pre-final years of MMCHRI. I feel proud to be a part of such an elite institution where students are taught by such great teachers whose teaching goes beyond the classroom. Also, they are the one to be thanked for organizing such a huge event. A competition makes one strive to do better. It trains to hunt for the challenges and to tolerate setbacks. Knowledge becomes power only when we put it into some use. We all are assembled here today to encourage, appreciate, motivate, and cherish the young minds present among us. I wish this national quiz enlightens us all and provides us with approaches to deal with problems of tomorrow. As you all know, these type of quiz competitions gives an opportunity to boost our general knowledge in medicine, understanding the subject in depth, and also it increases the presence of mind. All these competitions would certainly develop the critical thinking and creative skills which will make them to take appropriate decisions in their professional life. I would give my regards and appreciation to all the top 15 students who have made to this quiz by competing with more than 1,000 students all over India. Please remember, every participant here is a winner, irrespective of any result. I wish you all the best and I heartily congratulate all the students. Thank you.
Thank you, sir, for your enlightening speech. Now, I would like to call upon our respected Dr. Muthulakshmi ma'am, Vice Principal, MMCHRI, who is a seasoned scholar, navigator of this flagship of knowledge, to present a brief agenda about the event Icarus.
She has done her UG at Government Kilpauk Medical College and PG in DGO at Government Madras Medical College, MD PG in Stanley Medical College. She is a recipient of gold medal from IABMS. She is an administrator and the first MCI inspector from Government Vellore Medical College. She has present about 10 national and state journals.
With the blessings from our trustee, managing directors, vice principal and dean of Meenakshi Medical College, this is the occasional academic events feast for the students. So I welcome you all for this feast program by clinicians of this batch who did a wonderful job for conducting the intercollegiate quiz. So I am grateful to welcome the students of intercollegiate quiz event Icarus. I feel privileged to open this event and stand here where many accomplished students who I admired and looked upon once. I heartily congratulate the top 5 teams who have come all the way competing with 1,000 plus students all over India. We have gathered here not only to celebrate the event, but also the talent, passion, triumphs of each one of us. Every child is different and thus have own potential to growth. All students are exhibiting their own talents and capabilities will become the responsible and great citizens of India future. Now let's start with the event, and I once again officially welcome the participants, students and teachers to the event. I wish you all the best for the participants. Thank you.
Sakshi Satish Rani is a second year MBBS student in Dr. Vittal Rao Vikhe, Patil Foundation's Medical College and Hospital, Ahmednagar, Maharashtra. She is here to talk about how she stepped up her education in the last 18 months with the help of Clinical Key Student. She considers herself lucky to have stumbled upon this education platform early in medical school and plans to keep upgrading and challenging her learning through it. I request her to enlighten us about her experience.
Good morning, everyone. I am Sakshi Rane, Elsevier Student Ambassador for the year 2021. I am a second year medical student at Dr. VVPS Medical College in Ahmednagar, Maharashtra. So I came across Clinical Key Student last year accidentally when I registered for the Clinical Key Student National Challenge. While it is not something that is conventionally recommended by your peers for preparation of a studying of any kind, I believe that once you get familiar with it, it is like a hidden gem. So today I'm here to demonstrate some key features of Clinical Key Student. Allow me to share my screen. Is this visible? Hello, is this visible?
Sakshi.
So today I will be showing some key features of Clinical Key Student. Since today's quiz is on endocrinology, I will be using that as my search result. The first thing I want to show you is how you can browse for books using this app. The first thing you can do is you can look up books through all years. That means when you type endocrinology in the search section, you get books which have the topic endocrinology throughout all years. That means you have adrenal insufficiency in medicine, you have physiology, you have pediatrics, you have biochemistry, you have medicine, so on. That means you can actually integrate your search result and not only study endocrinology limited to one particular year of med school, but through all years. And I think this is really important for preparing for quizzes. Further, if you want to study endocrinology limited to a particular specialty, I feel you can customize your search result accordingly and look up basic sciences. You can look up just biochemistry, etc. This is the first thing. The second feature is you can go for videos. The most important feature of these videos is that they have case-based learning. And I feel the more you go ahead in med school, the more important this is going to become, especially since a lot of our entrances are now moving for case-based questions. So I'll show you how they are teaching pituitary using cases.
Here is radiation after you do surgery, and you're still residual. When you use it anymore, based upon not successful, you may consider drops prolactin levels. Your woman is evaluated for a 3-month.
So this is an example of a case, and they'll be teaching everything about endocrinology in one case. And I think that is a really good feature, and it is going to help us when we are going ahead in med school. The next feature that I want to talk about, which I have been using excessively, is assignments. The reason I use this is because you can allot questions to yourself and they are of USMLE pattern. Now, a lot of y'all may argue that if you want to prepare for an Indian entrance, why would you trust an application that is taking USMLE based questions? That is because now that we have seen a lot of questions in our entrance also are case based, and I think that is of the USMLE system. So here I'll be taking endocrine system. I am allotting questions to myself. Test on endocrine system. And here you have your questions. The most important thing is that all the questions are case based. Not only that, once you are done with answering, they give you correct explanations with references from standard textbooks. Not only this, you can also assess your performance. You can check what are your lowest scoring topics, your least confident topics, and keep testing them repeatedly till you get 100% correct. The last feature I want to talk about is presentations. Here you can actually create presentations and add references from some of the most high-end textbooks available in the country. And now this can directly be downloaded as a PowerPoint presentation. So that's it from my end. I request you all to go check on Clinical Key Student and try on the different features and let us know how it is. Thank you.
Meenakshi, for your articulate speech. I would now like to call upon charismatic Kavya Chabra to deliver the welcome address. She has been an active participant and enthusiastic member of Genesins.
It is rightly said, knowledge has beginning but no end. A very good morning to everyone present. It's a pleasure to welcome each one of you to the much awaited Accumbens 2021. This event has been in works for over 2 months now, and today we are inaugurating this with a hopeful heart that each one of you acknowledges and cherishes our fruits of labor. Accumbens is an early tradition of Meenakshi Medical College, Hospital and Research Institute, and under the blessings of Thiruer N. Radhakrishnan, Chancellor Maher, and Dr. G. Ra Gokul, Managing Director of Meenakshi Medical College, Genesins is extremely proud and ecstatic to take this tradition forward. We would like to give a special mention to Honorable Dean Sir Dr. K.V. Rajashekhar, the captain of our ship, under whose guidance we were able to execute this program. We would also like to applaud Dr. Muthulakshmi ma'am, Dr. Mithun sir, and Dr. Mahendran sir for their constant guidance and support. We are honored to have with us our honorable quizmasters, Dr. Punita ma'am, Dr. Shiv Shankari ma'am, Dr. Parimala ma'am, Dr. Thamara Selvi ma'am, and Dr. Shanma ma'am. When we have such great leaders, the team is motivated to give their best. We would also like to extend our heartfelt gratitude to all our esteemed professors who have always been our guiding light. We congratulate our finalists, Team Berlin, Team Tokyo, Team Nairobi, Team Rio, and Team Denver, who made it to top 5 with their perseverance, defeating teams from all over the country. On behalf of the conducting batch, I'm extremely overwhelmed to address you all on this auspicious occasion of Icarus 2021. We wish all the teams the very best.
Thank you, Kavya, for your enthusiastic speech. Now, I request Dr. Shiva Shankari ma'am to felicitate Vice Principal of MMCH and RI, Dr. Muthulakshmi ma'am. Thank you, ma'am. Success in life comes when you simply refuse to give up. With goals so strong that obstacles, failure, and loss only acts as motivation. One such example of the above saying is our passionate participants who have come a long way with drift from prelims to finals. In prelims, there were about 340 teams from all over India, out of which 100 were selected for semi-finals. From those 100 teams, it was only the 5 teams who could make it to the top, proving to be quite wicked.
We feel extremely elated to welcome the top 5 teams who could make this far.
Team 1, Berlin. Sukrit Nandan M, 3rd year, Praveen R, 3rd year, Emima Gracia J, 2nd year from Madras Medical College.
Team 2, Tokyo. Ubiyarasi, 3rd year, Vishwata, 3rd year, Rakesh C. CRRI from IGMC and RI.
Team 3, Nairobi. Balaji Dattatreya Shukla, CRRI. Armansh Seth, CRRI. Utkarsh Anand, CRRI from Maulana Azad Medical College, New Delhi.
Team 4, Rio. Tilesha Patil, 3rd year. Nishta Mahajan, 3rd year. Ketki Sarvankar, CRRI from Jipma, Pondicherry.
Team 5, Denver. Anirban Deb, CRRI. Vikas Saho, 3rd year. Saravanan S, 3rd year from Jipma.
Without taking much of your time, let's start the event. Round 1. Figure out the pixels. A good teacher can inspire hope, improve the learner's power of imagination, and motivate them to understand the true worth of learning. They energize the learners and satisfy their needs by engaging them in all activities of learning. One such teacher is none other than our very own Dr. Shivashankari ma'am. She completed her UG from Raja Muttaya Medical College and MD from Dr. ALM PG Institute of Basic Medical Sciences. She has done about 28 international journals and 3 conference proceedings in state journals.
Good morning all. A very warm welcome to all the teams, and I want all the team members to turn on your video and just say a hi and introduce yourself so that we can check your audio and video. Yeah. Team 1, Berlin team. Just wave your hand, Berlin team. Yeah.
Good morning.
Say a hi or something so that we want to check our audio. Yeah. Team 2, Tokyo. Tokyo team, just say hi. Tokyo team is there? Okay. Team 3, Nairobi.
Good morning, ma'am. Good morning, ma'am.
Yeah, Tokyo team. Nairobi team. Is it audible?
Yes, ma'am, it is audible.
Yeah. Okay. Team 4, Rio. Rio team. Are you all there? Just say hi.
Good morning, ma'am.
We are just checking the audio and video. Team 4, Rio team.
Good morning, ma'am.
Oh, yeah. Team 5, Denver.
Good morning, ma'am.
Yeah, good morning. So welcome you all the best to all the teams. We'll be starting the first round now. So the first round will be figure out your pixels, and I'll just read out the rules and regulation. You have to answer all the questions by decoding the given image. 5 questions for each team. There's no negative marking. Each correct answer will be awarded with 10 points. 20 seconds timer will be started, An answer must be given within the stipulated time. A quiz master's decision is the final decision. So are you all aware of the rules now? We'll start with the quiz. Okay. Turn. Yeah. So team 1, Berlin team. Berlin team.
Yes, ma'am.
So,
Yes, ma'am.
yeah. There are totally 6 set of questions. You can choose any one.
It's not great.
House, ma'am. House.
House. Yeah, good. Okay. So question number 1 is, what is his contribution to endocrinology?
Question. Are we Cushing's disease?
No, it's anti-androgens. Question number 2, identify the condition marked in the given picture.
Craniopharyngioma.
No, it's macroprolactinoma. Or even you can say you would have given some differential diagnosis for it, like pituitary tumor or pituitary pharyngioma, pituitary meningioma, like that. Okay, next question. Identify the instrument.
Oh, testis or size with the age. It's like testis. The testis size with the age is measured with this instrument. There's some stethoscope kind of thing. It is like, for an endocrinologist, is the stethoscope. The size of a testis of a male child is correlated with this.
Okay, we'll see the answer. It's oxidometer.
Yeah. That's it, right? It's correct,
Okay.
right?
Next question. Identify the sign.
We are not able to see.
We are not able to see the question.
Some other thing is there.
1 minute, 1 minute. You saw the answer for the last one?
No.
The answer for the third question is oxidometer. Yeah. So the answer for third question is oxidometer. Okay, next question. Identify the sign.
Lid retraction in thyroid of neuropathy.
Joffrey sign. Lid retraction in thyroid after.
Pardon? It's not clear.
It's not clear in that. Lid retraction in thyroid ophthalmopathy, Graves ophthalmopathy.
Joffrey sign.
Yes, it's dalprinson. Team 1, it's a good try. Identify the drug from the given chemical structure.
Negligent. Meglitinate.
No, it's octreotide. Octreotide. Okay, so good try and all the best for team 1. Next, team 2, Tokyo team. Which one you want to choose?
Sean Murphy.
Sean Murphy.
இது வந்து கண்டுபிடிச்சாரு ஓகே அந்த இவருக்கு
Sean Murphy.
ஸ்டார்லிங் ஃபோர்ஸஸ்
Pardon,
ஸ்டார்லிங்
which
கண்டுபிடிச்சாரு
one you want to choose?
நேம் பண்ணாரு ஸ்டார்லிங் நேம் பண்ணாரு எண்டோக்ரைன் Darling.
Then they have to choose it.
Cake.
So what is his contribution to endocrinology?
He identified the first hormone. Starling.
No, we are not asking the name of the person. What is its contribution?
He identified the first hormone.
Yeah. Which one? Which hormone?
Yes. Question வந்து what is his contribution? And yes, start ஆகுது. First contribution. Starting and basis. Growth hormone.
Okay, anyway, time up. We'll move on to the answer. It's a secretin hormone or the vasopressin discovery. Okay, the next question. Identify the above condition which is a complication of diabetes mellitus.
Clayton's joint.
Are you sure?
Yes, ma'am.
Okay. It's Charcot neuroarthropathy. Okay, the next question. The above picture shows what?
Ferriman Galway pathway scoring for hirsutism.
You can think and tell till time is there.
Can you repeat the question, ma'am?
What do you see from this picture?
Tanner staging.
Time up. It's modified Ferriman-Galway scoring system for hirsutism.
Ma'am, we said first itself, ma'am, for hirsutism.
We said Ferriman-Galway scoring.
No, it's a scoring. See, you should be more specific. No, you should tell what is that scoring. At least you could have told the disease name. It's some scoring system for hirsutism, something like that.
No, we said Ferriman-Galway.
But anyway, we'll consider. Identify the gross finding and drug causing it.
Adrenal gland blockage. Infection. Ischemia.
Time up. It's black thyroid or thyroid hyperpigmentation due to minocycline. Okay, next question. Identify the condition.
Macular star.
Okay. Can be much more specific. Anything else you want to add up?
Papillary.
Diabetic palpinopathy. Okay, good try. Tokyo tea. Next, we'll move on to Nairobi team.
Meredith Gray. Ma'am, Meredith Gray.
Which one you want to choose?
Meredith Gray.
Okay. Okay. So, what is his contribution to endocrinology?
बेली लव जैसा नहीं लग रहा नहीं बेंटिंग ही बोल देते हैं मैम डिस्कवरी ऑफ इंसुलिन हेलो मैम डिस्कवरी ऑफ इंसुलिन
Vitamin D discovery.
ओके मैम
Okay, next question. Identify the pathological finding in the marked area of the given image of CT scan.
Ma'am, this is adrenal calcification seen in Wallman disease.
Yeah, still time is there. You can think.
वही लग रहा है Wallman नहीं लग रहा है. Ma'am,
I want the exact pathological finding.
Ma'am,
Adrenal calcification in Wallman disease.
Okay, time up. It's bilateral adrenal calcification.
Ma'am, that's what we told, adrenal calcification.
Okay, moving on to the next question. Identify the histopathological finding.
Samoma body है ना ये तो हाँ
अरे ये थायराइड
अरे नहीं
कोलोइड्स है और वो लिम्फोसिटिक इन्फिल्ट्रेशन है, हाशिमोटो थायराइडाइटिस जैसा लग रहा है भाई।
क्या बोलना है?
लिम्फोसिटिक इन्फिल्ट्रेशन इन थायराइड
बोल दे
मैम, लिम्फोसिटिक इन्फिल्ट्रेशन इन द थायराइड ग्लैंड,
हाशिमोटो
Okay, we'll
थायराइडाइटिस।
see. It's medullary carcinoma of thyroid. It's stained with Congo red stain. Okay, moving on to the next question. Identify the syndrome.
टर्नर नहीं वेब ने क्या नूनन है ना?
हाँ, नूनन सिंड्रोम।
नूनन syndrome.
Are you sure?
यस मैम।
Yes ma'am.
Okay, yeah, very good. Noonan syndrome. Moving on to the next question. The hormone which is responsible for change in temperature in this picture.
Progesterone. Ma'am, progesterone.
Yeah, but still you can have some more time to think.
No ma'am, progesterone.
Sure?
Yes ma'am.
Yeah. Yeah, good. It's progesterone. Very good. So good try. So
Ma'am,
congratulations to this team.
Thank you ma'am. Excuse me ma'am.
Yeah.
Ma'am, we'll be getting points for the adrenal one, right?
I didn't get you. Yeah.
In the adrenal question, ma'am, we'll be getting the points for that, right? Adrenal calcification one.
Involvement disease.
I didn't get you. Second
Ma'am,
question.
Yes ma'am. Adrenal.
Yeah.
We answered calcification, so we'll be getting points, right?
Adrenal calcification.
Okay, the finally will decide. It's a quizmaster's decision is be the final. But anyway, you have answered well, and it's a good try.
Okay,
Congratulations to your team.
Thank you.
Thank you, ma'am.
Yeah. We'll move on to the next team, Rio team. Rio team.
Ma'am, we want to choose
Can you please
Conrad
turn on
Hopkins.
your video? Yeah. So which one you want to choose?
Conrad Hopkins.
Can't able to hear. Ma, can you be louder?
Conrad Hopkins. Conrad Hopkins.
Conrad Hawkins.
Yeah.
Is that you want to choose?
Yes, ma'am.
Can you please be louder? You're not able to hear anything. Or increase your volume.
Conrad Hopkins, ma'am.
Who are your other teammates? Can you just show them? Yeah, one more. Yeah. So which one you want to choose from this set?
Conrad Hopkins.
Okay. Yeah. So question 1 will be, what is his contribution towards endocrinology?
Hansworth. Okay.
Time is up, guys. The answer is thyrotropin releasing hormone. So question number 2, identify the hormone.
Progesterone.
Can little more think and tell. Okay, time is up. It's thyroxine. Okay, question number 3, identify the given syndrome.
Turner's. Turners.
Are you sure?
Yeah.
Yes, we'll move on to the answer. Good. It's Turner syndrome. Question number 4. Identify the given clinical condition.
पीछे क्वेश्चन ectopic lingual thyroid. Lingual thyroid.
Time is up.
Lingual
It's lingual thyroid.
Ma'am, we said lingual thyroid.
Okay.
We said
Okay, anyway,
lingual
good
thyroid.
try. Rio team, it's good try.
We said
Identify the
lingual
given
thyroid.
syndrome.
36 androgen insensitivity syndrome.
Little bit louder, no?
Androgen insensitivity syndrome.
Yeah. It's androgen insensitivity syndrome.
Lingual का बोलो.
Or the other name is testicular feminizing syndrome or male pseudo hermaphroditism. Yes, good try.
Ma'am, we said lingual thyroid.
A good try, Rio team.
Ma'am. Excuse me, ma'am.
Congratulations.
Excuse, ma'am. Ma'am.
Yeah.
We said lingual thyroid.
Is any problem?
Yeah, we said lingual thyroid.
I didn't get you. Yes, ma'am.
We said lingual thyroid.
That will decide in the end.
Okay.
So team 5. Team 5.
Yes, ma'am.
Team. Yes, you can choose from the set.
Yes, ma'am. Male melendis.
Okay. So your question 1 will be identify the physician.
Kocher, father of thyroid surgery.
Still you have time to think. You can think and tell. Are you sure? We'll move on.
Kocher, yeah.
You're sure?
Yes, I'm sure.
Yeah. It's Emil Theodor Kocher. Good. Next one. Identify the given condition.
Congenital hypothyroidism.
Right.
Congenital hypothyroidism.
Hello? Hello, can you hear us, ma'am?
So you want to fix up that answer?
Yes, we want to go with that answer.
Okay. It's congenital hypothyroidism. Good. Okay. Third question. Identify the structure.
Pro-insulin, ma'am.
Yeah. No, it's beta HCG. Okay, moving on to the next question. Identify the given condition. Yes, time is up, guys. It's fractional retinal detachment or advanced diabetic eye disease. Okay, next question. Identify the microscopic feature of the given slide.
Fun test. Fun test to identify the.
Yeah, just
estrogen.
identify the slide.
The spin buckets fun test, no? Spin bucket. The ferning pattern, which is due to estrogen.
So what's your
Depicts-
final answer now?
Spin buckets fun test.
It's burning pattern of cervical
Burning
mucus. That's the right answer.
That is only the fun test, ma'am.
Yeah. Okay, anyway, we'll give you the marks. Good. What is his contribution to endocrinology? Answer. முடிஞ்சிருச்சுலமா 5 sets. Yeah, team Denver, you have done well. Congratulations. So I think all the 5 teams have done well. Congratulations to all the teams. Okay, now we'll announce the scores for round 1. Berlin team 15 points, Tokyo team 10 points, Nairobi team 30 points, Rio team 30 and Denver 30. So congratulations to Nairobi, Rio and Denver team and all the best to all the teams for the next round. Thank you.
the full marks. Though they have answered only half, but they gave the explanation for that question. So finally, we have considered the question and we have given them full 10 marks for it. So now the final score will be Berlin team 10, Tokyo team 10, Nairobi, Rio and Denver 30-30 each. So
Ma'am,
final score for round 1.
ma'am, we have a doubt.
We want all the participants to show your faces. Only one person is answering and we couldn't see the other two.
Ma'am, we have a doubt from team 2.
Yes.
Like for the first question, we answered like it is the first hormone. Secretin is the first hormone which was discovered. Can we get half points for that?
No. Actually, you should be very specific for that. Anyway, we'll see in the next round. Okay. All the best for your next round.
This name and also the what is the hormone, right?
Okay, but for some questions, no, we expect the exact answer. So wish you all the best for the next round. Okay.
Team participants aren't visible. And I request all the teams to adjust your camera properly and all the participants should be focused on the camera. Or else the quiz masters won't accept your answers. They won't take it into consideration. We request all the participants to be seen. We request the Rio team to change their place as the glare from the behind is too much and we aren't able to see anybody.
नहीं ठीक है.
Excuse me, are we visible?
बाकी टीम से
No, you aren't visible. Not all the 3 participants are visible.
Now?
I request you all to put up a screen behind. I request Team Rio and Team Denver to change their place. And I request all the three participants to be visible. I request Team Berlin to switch on their camera.
Camera is on only.
I request Team Denver to switch on their camera. I again request all the participants to be focused on the camera, or else the quiz master will never consider your answers. Thank you, ma'am, for making this round a success. Now, I request Dr. Punita, ma'am, to felicitate Dr. Shivashankari, ma'am.
Round 2. Every detail counts. A teacher is blessed with a thoughtful mind, puts a lot of thought into how they present the material. She is our beloved Dr. Punita ma'am, Associate Professor of Department of Physiology, who keeps everyone engaged with the useful lessons and encourages every student to try. She completed her UG from Government Kilpauk Medical College and MD in Physiology from JIPMA Pondicherry. She has done 4 international and 5 national journals and has the credit of having authored a book in physiology.
Students, am I audible? Teams,
Yes,
all the
ma'am.
teams, am I audible?
Yes, ma'am.
Yeah. Okay, so this round is called like every detail counts, okay? And now I'm going to read the rules for this particular round. So each team, you will be getting 2 sets of 5 pictures, and only one picture will be displayed on the screen, okay? You have to connect all the things. After 15 seconds, subsequent pictures will be displayed at equal intervals of time, and 50 points will be awarded for giving the correct diagnosis at the first picture, okay? And for every picture 10 points will be detected. So after taking all the 5 pictures, if the team fails to give the correct answer, the question can be passed to the next team, and a reward of 5 points will be given if they answer it in 10 seconds. Whether the rule is clear, a pass is there in this round.
Ma'am, can we attempt at every picture or do we get a total attempt of only one?
Total attempt of only 1. So students, one more thing, this is the order of team. Team 1 is Berlin, team 2 is Tokyo, 3 is Nairobi, 4 is Rio, and 5 is Denver. So if team 1 want to pass, it will be passed only to the second team, okay? So next pass is not there. Only if they are not answering it, that's all. Chance is over. Only one pass is allowed, okay? So this round, I'll be starting with team 2, Tokyo. Okay? IGMCRI, please be ready. Team 2, Tokyo. So choose one of the fire. And yes, your time starts now. Team 2, Tokyo.
Next picture. Insulinoma.
Yes, that's the right answer. So you'll be getting 40 points. Very good. Next set. Now the second set of question for team 2.
Next picture. Next picture. Obesity.
Time is up.
Next picture.
Like we are switching on to the next picture. Yes, time is up. Next picture.
Albert's hereditary osteodystrophy.
Yes, I'll give it to you. Pseudo hypoparathyroidism. Yeah, you are told type 1 like Albert. I give it to you. Yes, team 2, well done. Now we'll move on to the next team, team 3, Nairobi.
Dark. Nature. Dark. Dark? Ma'am, dark.
Dark. Yeah, your time starts now.
ये है क्या pineal gland है ना? Pituitary. Next picture. Ma'am, next picture.
Yeah, you want, yeah, next picture.
Shit. मोटर ऑयल अपीयरेंस है क्या? क्रीम पेरेंजियमा है क्या ये? मोटर ऑयल वाला लिक्विड है। बट ये बच्चे की फोटो तो नहीं है। तो बच्चे का फर्क पड़ता है बोल दे। हाँ, अब एक अटेम्प्ट लेना है। मैम, क्रेनियोफेरेंजियोमा।
No, I can't give it. It's not craniopharyngioma. I think your chances, they can still answer. Yeah, you can still answer.
Okay, ma'am, next picture. Ma'am, next picture. Visual field. Scotoma है ये. Visual field defect. ये वो तो नहीं ट्रैकोयर्स. नहीं भाई, सिंपल आंसर होगा कोई. भाई ये फोन तो ऑफ करनी चाहिए. अरे और अंदर. Next picture बोल दे. Ma'am, next picture.
Next picture.
अब तो बोल दे मैक्रोप्रोलैक्टिन वही है. पिट्यूटरी एडिनोमा. मैम, पिट्यूटरी मैक्रो एडिनोमा.
It's not adenoma actually. Should we give them the last picture? Yeah.
ठीक है. ट्रांसमिनल डिसेक्शन है.
Now we can pass it to Rio.
मैम, मैक्रोप्रोलैक्टिनोमा.
What? Yeah, I'm not able to hear you.
मैम, मैक्रोप्रोलैक्टिनोमा.
No. It's not the right answer. The question passes to Rio team. Only one chance will be given to you, Rio. Yeah, your time is up. The answer is Rathke's left cyst. Okay, it is a cyst. Okay. So next set of question to Team Nairobi. Your time starts now.
तो देखा है
Equal is strawberry or bladder?
नहीं नहीं मैम नेक्स्ट पिक्चर
Yeah, next clue please.
भी क्या ये तो देखा हुआ है कोलेस्ट्रॉल स्टोन्स है ना ये मतलब ये पिगमेंटेड स्टोन्स है ना ये
Cholesterolosis is a strawberry. Then we cannot see the second
मैम
picture.
सेकंड पिक्चर इज नॉट विजिबल
Yeah, want to please.
मैम वी कांट सी द सेकंड पिक्चर ये सेकंड है क्या नहीं थर्ड है ये अरे
कोई जो दिख रहा है उसी से चल रहा है.
ये तो कोलोइड है बहुत सारे
हाँ, multidodal water है, colloid है. Multidodal water है क्या आंसर?
थर्ड पिक्चर ले ले
थर्ड पिक्चर.
फोर्थ आ गई भाई
मतलब
सेकंड
next picture.
मैम थर्ड पिक्चर
So this is the second picture for you, okay?
यस मैम
चलो यार.
ये तो वही है ना थायराइड ग्लैंड ही है ना
Multidodal water लिया था.
Yeah, moving on to the third picture. Hyperlink problem.
एक साथ चार दिख के
Okay, this will be considered as third only.
बिफोर आफ्टर
इसे एक ग्लैंड बड़ा हुआ है, ग्लैंड हटा दिया. Multidodal
थैरोइडेक्टमी
multidodal water ही बोल दे. वही लग रहा है.
वही बोल दे मैम मल्टीनोडुलर गोइटर
Yeah, it's the right answer. Excellent. We will consider it as three pictures only. Okay. Now next team. Yeah, Team Rio. Please select one of the accounts.
Nature.
Nature. And your time starts now.
Next picture. Next picture, ma'am.
Yes, next picture.
Yeah, next picture.
Yeah. So time is running.
Carcinoid.
Please answer it again.
Carcinoid. Carcinoid.
No, we are not able to hear you. Your time is up.
Carcinoid. Carcinoid.
They told. Yeah, okay. Carcinoid is the right answer. Yeah, first one is somatostatin analog, and this is the answer. Right. Okay. So next set of question.
Next. Next picture.
Next picture.
PCOS.
Yes, right answer. So with third picture, you were able to answer. But anyway, yeah, excellent team Rio. Now we are moving on to team Denver, team 5, Denver.
Wind.
Wind. Yeah, your time starts now. Yeah, next picture. The time is running.
Next.
Okay, next picture.
Next. Next.
Next picture.
Answer. Pendred syndrome.
Yes, excellent. Right answer. Okay, next set of question to team Denver. Your time starts now. This is the first clue.
Next clue.
Next clue, please.
Next.
Third clue, please. So time
Addison's
is-
disease.
Yeah, Addison's disease. Right answer. So excellent team Denver. Now I'll move on to team 1, Berlin. So please choose.
What is remaining, ma'am? Water and earth.
Team Berlin, please.
Water.
Water. Okay, your time starts now. And here is your first clue.
Next clue, ma'am.
Next clue, ma'am.
Yes. Second clue.
Next clue, ma'am.
The time is running for the third clue. 3 more seconds. Yeah, we can move on to the fourth clue.
PCOS Haran syndrome. HAIRAN. In PCOS, it is Haran syndrome. Stein-Leventhal.
No. Wrong answer. Last clue. Yeah, time up. The question passes to Tokyo. Team Tokyo.
Metabolic syndrome.
Sorry, wrong answer. The answer is He syndrome or leprochonism. Yeah, next set of question for team 1, Berlin. Here is your first clue.
Next clue.
Next clue, please.
Erectile dysfunction. Basically, erectile dysfunction. Al-Aziz-Korea, okay. Next clue, ma'am.
Next clue. Your time is running. You can identify the scientist, it's quite easy. Yeah, next clue.
Ma'am, Kallman syndrome.
Yeah. Please, can you repeat it?
Kallman, K-L-L-M-A.
Yeah, right answer. So with fourth clue, you are able to get it. So I think all the teams you have done well. So all the best for the next rounds. Thank you. Team 1 Berlin, you have got 20 points, and Tokyo 50 points, Nairobi 30 points, Rio 40 points, and again Denver with 50 points. All the best, all the teams. Thank you, ma'am, for this mind-racking session. Now, I request Dr. Parimala ma'am to felicitate Dr. Punita ma'am. Round 3. Ace with your case. A teacher provides both a great mix of listening, speaking, practical learning activities, and a very safe supporting learning environment. She is our very own HOD of Pharmacology Department, Dr. Parimala ma'am, for encouraging us to learn and try new competencies. She completed her UG from Chengalpattu Medical College and MD Pharmacology from Christian Medical College. She has done about 9 national journals and 6 international journals.
Hello. Good afternoon, my dear teammates. Hello. Can you hear me? Am I audible?
Yes, ma'am.
Yeah. So we'll go on with the scores for the second round, which is a connection round. Berlin team with 20 points, Tokyo with 50 points, Nairobi with 30 points, Rio with 40 points, and Denver with 50 points. So we'll move on to the third round. Ace your case. Am I audible? Can you respond, please?
Yes, ma'am.
Yeah, I can see all the team members. Very good. Okay, wish you all the best. Nairobi.
So the ground rules for ACO case, it's like each team will be given 2 case studies with 5 sub-questions in it. Each correct answer will be awarded with 10 points, making a total of 100 points, 50 plus 50 for answering all questions correctly. There are no negative markings. After reading the given case study, 3 minutes time will be given to answer all the questions. There is no pass, there is no negative markings. Quizmaster's decision is final and binding. Wish you all the very best. Shall we proceed? Yes, we'll start with team 3, Nairobi. Nairobi, are you ready?
Yes, ma'am. Iron Man.
So please choose your quote.
Ma'am, Iron Man.
Iron Man. Okay. Julie, age 24 years, is referred to the endocrinology clinic with excessive facial hair growth and irregular menstrual periods. She is overweight with BMI of 30 kg per month. Her menarche was at the age of 13. Recently, her cycle has been irregular once every 3 to 4 months. Pelvic ultrasound shows multiple cysts in both the ovaries. The questions are as follows. What is the position of ovary in nulliparous and multiparous women?
अभी pause करना.
What is meso-ovarium and what is its use? Visceral relation of lateral surface of ovary. Lymphatic drainage of ovary. And last question, what is the line of use? Each question carries 10 marks. No negative markings. Time starts now. There is no pass. Yes.
Ma'am, mesovarium connects ovary to the broad ligament, the posterior surface of the broad ligament, and the lymphatic drainage is para-aortic lymph nodes. And in nulliparous, the ovaries are lower placed.
So, are you answering to the first question? You please name it and answer it.
We have
Which
to go
question
order
it is?
wise. Ma'am, question number 1, in nulliparous, the ovaries are lower and anteriorly placed. And in
Okay.
multiparous, these are higher placed. And mesovarium, ma'am, second question, the mesovarium connect the ovary to the posterior surface of the broad ligament.
Okay.
And ma'am, fourth question, the lymphatic drainage of ovary is para-aortic lymph nodes.
Mesovarium में vessels.
And ma'am, second question also, the mesovarium contains the blood vessels which are entering the ovary.
So they are clamped before oophoid.
Or
lymphatic drainage.
Ma'am, the fourth answer is the para-aortic lymph node. The lymphatic drainage is, and line of use क्या है? नहीं पता. And ma'am, the third question, ma'am, the visceral relation of lateral surface of ovary is, ma'am, the blood vessels are lying in it, ma'am, and the pelvic wall is on its lateral surface. Ma'am, we don't know the fifth का नहीं पता ना. Ma'am, we don't know the answer of the fifth question.
You know or do not know? What is the line of use?
No, ma'am, we do not know.
Okay. So please focus the answers. We'll see if it is correct. How many questions are correct? How many questions are correct? First one is correct. Second one is correct. Third one is wrong.
Obturator vessels.
Fourth one is.
Correct. Fatty liver.
Fifth one you did not answer. Three
Yes,
correct.
Okay.
Third one is also correct. Yes. You get. So 3 answers are correct for this set 1. So we'll move on to the next set of questions, second set. A 33-year-old female patient admitted in the hospital with complaints of visual disturbances and paroxysmal headache, memory impairment. Ophthalmic examination was done. Visual field defect was detected along with optic nerve atrophy. Light reflex was normal. Pituitary examination was done. Cortisol levels were low with normal growth hormone, thyrotropin, prolactin and sexual hormone. So what is your probable diagnosis? Second question, what are the 2 pathological variants? How will you differentiate between them? The above condition arises or takes origin from? Names and differential diagnosis. Last question, most commonly performed surgical approach for the above condition. So the question goes to Rio. Are you ready? So the time starts now. Sorry, Nairobi. It's the second set of questions. Nairobi. Time starts now. So team Nairobi, 1 minute more. Time is running.
Ma'am, बोल.
Yes.
Ma'am, the
You
diagnosis.
number the question and then answer it.
One बोल. हाँ बोल. Ma'am, first answer is craniopharyngioma.
Yeah.
The second answer is it has 2 types, adamantinomatous and papillary.
Yes. Third question. Answer.
And ma'am, we'll differentiate between them based on histopathology.
Cannot hear you properly. Third question answer.
Second question is adamantinomatous and papillary.
Okay, we got the, yeah.
Okay. The third one, it takes origin from the Rathke's cleft remnants. Yes, ma'am. Fourth one is, ma'am,
yeah,
Rathke cleft remnants.
Okay, fourth one.
Ma'am, differential diagnosis are Rathke's cleft cyst and pituitary adenoma.
Okay, fifth one.
Ma'am, transphenoidal resection.
Second question,
Have you
second part.
completed it?
Ma'am, second question, second part will be differentiated between them based on histopathology.
Ma'am, they have, ma'am, motor oil appearance. The adamantinomatous variant has motor oil appearance.
Okay, we have received answers for all the 5 questions. 2 more seconds. Yes, your time ends now. We'll just focus on the answers. Yes, absolutely correct. You're getting full 50 marks. Congratulations, team. So, Nairobi has completed their set 1 and set 2. And then we'll go on to the team 4. Rio, are you ready? Please cheer up. Please say. Please
Yes,
unmute your
ma'am.
mic. Yes. Please cheer up. What do you want to choose?
Yes, ma'am.
What do you want to choose?
Superman. Superman.
Oh, you want to become a Superman. Supergirls, yes. So we'll focus on the question now. Set 2 is coming first. A 45-year-old male came to OPD with complaints of blurred vision, flashes for the past 2 years. There is no history of trauma or foreign body and is a known case of diabetes for past 10 years. Questions? What is your diagnosis? What is the test done to elicit the quantitative and qualitative analysis of this case? What is the surgical therapy? What are the anti-VEGF agents used in this condition? What is the histopathological finding of this condition? So, shall we start? The time starts now for you. Set 1.
Ma'am, proliferative diabetic retinopathy.
Yes, please be louder. Please tell the question number and answer it. First question answer.
Proliferative retinopathy. Proliferative diabetic retinopathy.
Okay, second one.
OCT angiography for quantitative.
Can you just expand it?
Optical coherence tomography and
Optical coherence tomography. Third question answer.
panretinal photocoagulation.
Please, one of you please answer in the mic.
Panretinal photocoagulation. Third question, panretinal photocoagulation.
Yes, third question answer.
Panretinal photocoagulation. Hello, are we audible?
Okay, go to the fourth one.
Fourth one, bevacizumab. Bevacizumab, ranibizumab.
Bevacizumab, ranibizumab. We'll check it.
Neovascularization.
I'm not audible.
Neovascularization.
Neovascularization. Then
Qualitative analysis of the case, fundoscopy.
histopathological finding.
Neovascularization for fifth.
Neovascularization. Anything you want to add?
Neovascularization में bleeding वगैरह देखी जाती है.
Okay. Third question, do you want to answer again? Third question. It was not clear. Surgical treatment.
OCT, third question. Panretinal photocoagulation.
Third question.
Vitreoretinal surgery and panretinal photocoagulation. Vitreoretinal surgery.
Vitrectomy.
Vitreoretinal surgery and panretinal photocoagulation. If there is a
check with the answers and Pushmaster's decision is final. What? Yes. Your time is up. We'll check with the answers. So first question is correct, diabetic retinopathy. Second question is also correct and you have expanded it. Third one is pars plana vitrectomy. So vitrectomy.
That is only vitreoretinal surgery, ma'am. Pars plana vitrectomy.
Okay, third is also correct. Fourth one, both of you answered ranibizumab, bevacizumab is. Fifth one, wrong. So you get 40 points for this set 2 first part. Yes, we'll go on to the next ACO case is a little bit lengthy case. Please read it properly. A 64-year-old woman presented with difficulty in concentrating, insomnia, intermittent fatigue, progressively worsening over last 6 months. The patient prior history was Hashimoto's thyroiditis treated with levothyroxine. Then he was referred to psychiatric department and was found to be generalized anxiety disorder with benzodiazepines. Within a month, she was admitted to hospital with following features of worsening of asthenia, altered bowel habit, hyperpigmentation in the elbow and heels, and also she presented with orthostatic hypertension. ECG revealed sinus tachycardia. In her previous lab report, CBC was normal, but there was presence of anti-nuclear antibodies. Current report elevated serum anti-thyroglobulin, elevated ACTH, and low fasting plasma cortisol level with adrenal cortex, autoantibody, and elevated blood sugar level for both fasting and postprandial. So what is your probable diagnosis and give your inference? First question. Second question, which HLA antigen has strong association with this disorder and what is the pattern of inheritance? Third question, what category of disorder does the above diagnosis belong to? Give it subtype, name other conditions belonging to the subtype. Fourth question, drug which can be used in the above condition with dosage. And last question, what is Whitaker's triad? So I think you would have read the whole question. So the time starts now.
Probable diagnosis is APS2 Schmidt disease.
First question answer.
Autoimmune thyroid. APS2 Schmidt disease.
Okay.
Autoimmune with autoimmune thyroiditis, autoimmune adrenalitis, and type 1 diabetes mellitus. Third is category. It is an autoimmune disease, and
please speak on the mic, ma. Please speak on the mic. We are unable to hear your audio. Please be clear.
It is an autoimmune disease. It is a type 2 of the autoimmune disease, APS2 Schmidt disease.
Fourth question.
The first one is APCD. Fourth, I don't know. Whitaker's triad is mucocutaneous candidal infections, hypoparathyroidism, and adrenocortical failure, Addison's disease. Are we audible?
Not audible. Fourth question, not audible. Answer.
Fourth, not attempting. Fourth, we are not attempted. Fifth is chronic mucocutaneous candidiasis, hypoparathyroidism, and Addison's. Whitaker's triad.
Answer.
Whitaker's triad, we told chronic mucocutaneous candidiasis, hypoparathyroidism, and adrenocortical failure, Addison's disease.
Okay.
And HLA antigen is HLA-DR3, HLA-DR4.
Okay, second question.
Pattern of inheritance. Recessive. Autosomal recessive. Autosomal recessive is the pattern of inheritance, and HLA antigen is DR3 and DR4. Yeah. Can you hear us? Drug.
So,
hydrocortisone.
have you answered all the questions?
Drug hydrocortisone.
Hydrocortisone is
the drug dosage. हाइड्रोकोर्टिसोन का डोसेज 100 to 200 ml in season होता है. बोल दो जो भी है. ठीक है. Dosage we don't know. किसको यार मेरे को
15 more seconds.
Okay, drug is hydrocortisone, HLA antigen is DR3, DR4, and pattern is autosomal recessive. Whitaker's triad we have answered, diagnosis we have answered, and third question.
So time is up. We'll check with the answers.
10 to 30 minutes.
Please focus the answers. Yes, it is correct. First question is Schmidt syndrome. which is characterized by autoimmune hypothyroidism, primary adrenal insufficiency, and insulin-dependent diabetes. Second question, you have answered DR4 and DR3 HLA, correct? Third one is polyglandular autoimmune syndrome, you have answered it. It is of type 1, 2, 3, and 4. Fourth one, you have answered partly hydrocortisone and insulin and dose, you have not mentioned, I think so. We'll leave it to the quizmaster's decision. And fifth one, you have answered correctly. It is a Whittaker's triad consists of mucocutaneous candidiasis, hypoparathyroidism, adenocortical insufficiency. Well done, Rio.
Excuse me, ma'am. Second question, they said autosomal recessive.
You told autosomal recessive, it is autosomal dominant, but you told DR4, DR3 correct. Partly we can give you.
Okay, ma'am.
Okay. All the best. We'll move on to the third team, Denver. Are you ready, Denver?
Yes.
Denver, can you just check with us? Okay.
Captain America.
So please answer to the mic. Little bit is not audible, so that we cannot hear you properly. Please mention the question.
Captain America.
Please mention the question and answer it. Okay? Yeah. What do you want? Yeah. Yeah. A 3-year-old child presented with symptoms of hypogonadism, cleft lip, and anosmia. Pedigree chart of his family revealed autosomal dominant inheritance. First question, name the syndrome. Second, what is the most likely gene involved? Third, this syndrome is usually associated with. Fourth, what will be the presenting feature in female with above syndrome? Fifth, women on above condition can be treated with. So, have you read the question? Let us start, Denver. Your time starts now.
First one is Kallman syndrome. Second one is Kal1 gene.
Second answer?
Kal1, KAL1.
Yeah, continue. Third answer, third question answer.
Fourth one is primary amenorrhea. Fifth one is pulsatile GnRH. Hormone replacement therapy. Pulsatile GnRH you can give.
GnRH.
Hormone replacement therapy. And hormone replacement therapy.
Third one, third question answer. Syndrome is usually associated with?
That primary amenorrhea, hypogonadotropic.
No, that is fourth one you have answered. What will be the presenting feature?
Syndrome is usually associated with.
Third one, what syndrome? The syndrome is usually associated with? First one you have answered Kallman. Second one you have answered some Kall gene, KLL gene. Third one you didn't answer so far. Fourth one you have answered primary amenorrhea. And fifth GnRH hormone you have answered.
Third one. Some polydactyly, some finger anomalies and skeletal dysplasia or something.
You have got 30 more seconds. You can just answer properly. For the third question, please.
Syndactyly and skeletal dysplasia.
Syndactyly. You want to fix, we'll fix it.
What?
If you want to complete, we can complete. Or 20 more seconds is there for third question.
Associated with.
Okay, can you repeat the answers, please, from the first?
Kallman syndrome, then
okay.
Kal1 gene, The syndrome is usually associated with syndactyly and skeletal dysplasia. Presenting feature is primary amenorrhea and pulsatile GnRH and hormone replacement therapy.
Pulsatile GnRH. Okay, time ends now. We'll just focus the answers. Please check it. Kalman syndrome is correct. Second, gene associated is wrong. Third one is wrong. Fourth one, you have half the way correct. Primary amenorrhea, failure of secondary sexual development. And fifth one, you have answered GnRH, pulsatile, but it's cyclic estrogen and progestin. So
we answered also hormone replacement therapy, na? And pulsatile GnRH and hormone replacement therapy once the mens start. We answered that in the first.
So this question, Quizmaster's decision is final. So Coleman, primary amenorrhea, and fifth, it's under discussion. Okay, we'll only 2 questions you have answered correctly. Okay, and we'll move on to the next set of questions for the same Denver team. Yeah, it's a 24-year-old woman brings a 10-day-old child to hospital after finding the child less responsive than normal, not feeding appropriately and vomiting several times for the past few days. The baby was delivered vaginally at term by the child's aunt and the mother received no pre or postnatal care. Examination reveals an ill-looking neonate with evidence of dehydration, heart rate 180, blood pressure 65/30, CRP 35, sunken fontanelles. There are no rashes. On unclothing, the child examined with external genitalia, a phallic appearance and the fusion of the skin folds surrounding it. No testes are palpable and the physician is uncertain about the sex of the neonate. So these are all the features: hemoglobin 17, hematocrit 55, white cells 14, sodium 135, potassium 6.2, urea 19.5, creatinine 65, ABG with pH 7.2 and air. And this is a genetic structure. What is your diagnosis? What is the reason behind the abnormal genital examination findings? Why are the serum electrolytes tests sent for? Any other test to be done? How does this condition present in adults? It's a lengthy case scenario. So we'll start the time now. Denver.
The first question is congenital adrenal hyperplasia due to 21-hydroxylase deficiency. What is the reason behind abnormal genital examination findings? Is that there is mineralocorticoid and glucocorticoid deficiency. So all the 7-hydroxy pregnenolone and progesterone are channeled into the androgen synthesis pathway, and there is increased DHES and androstenedione. Why are serum electrolytes test sense? Because to identify the salt wasting crisis, which is the most emergent of all the clinical features, and we have to manage that. And any other test to be done, diagnostic will be the 17-hydroxy progesterone assay, and the confirmatory will be by the enzyme assay has to be done. Enzyme mutation assay has to be done. And how does it in adults? In females it presents as this virilization, and in males it will be precocious puberty.
So you have come up with some answers.
What?
Hello?
Hello, ma'am, can you hear us?
Yeah, I can hear you. The first one is adrenogenital.
Congenital adrenal hyperplasia due to 21 alpha hydroxylase deficiency.
Hyperplasia. Second
Congenital adrenal hyperplasia due to 21 beta hydroxylase deficiency. What is the reason behind this? Because the precursors, the steroid precursors are channeled into the adrenal androgen production pathway because there is glucocorticoid and mineralocorticoid synthesis block. Electrolytes, serum electrolytes are sent for because there is hypoaldosteronism, salt wasting crisis is happening. So we have to identify that and manage that emergently. Any other test, 17-hydroxyprogesterone and the enzyme mutation assay, how does this condition virilization and precocious puberty?
Okay, time is up. We'll just focus on the answers, check with the answers. First one is correct, it is adrenogenital syndrome, and you have mentioned also 21-hydroxylase deficiency. Second one is also correct, because of distortion of external genitalia by excessive secretion of steroids. Third one is also correct, salt wasting syndrome. Fourth one is wrong, half of it is correct. Hormonal assay you have mentioned, but not the pelvic ultrasound. Fifth one is totally correct, virilization of females and feminization of males. Congratulations.
Hello ma'am, the fifth one, which we are not getting, we are getting.
Fifth one is correct.
Correct.
All correct.
Fourth one is half of it is correct. Pelvic ultrasound you didn't mention.
Okay.
Yeah. Thank you, Denver team, for your active participation. We'll just move on to the team 1, Berlin team. Are you ready? Are you ready, Berlin? Can you check with me?
Yes, ma'am.
Yeah. So what do you want to choose?
We'll go with Hulk.
Yes, Hulk.
Yes, ma'am.
Yes. 17-year-old male presents with symptoms of flushing, severe abdominal pain, coarse features and recurrent episodes of hypoglycemia. Lab diagnosis reveal high CGA levels, serum calcium of 14 mg per deciliter, prolactin levels of 200 mg per deciliter. Name the condition. First question. Second question, mention the chromosome which is involved in this condition. Third, name the triad of tumors involved in the above condition. Fourth question, what is the most common feature of the above condition? Fifth one, mention the important factor for cause of death for the above condition. Have you gone through it? Yes, your time starts now. Berlin.
Yeah,
Yes, are you ready with your answers?
Yes, ma'am. For A, condition is MEN1, multiple endocrine neoplasia or Werner syndrome.
Second one?
B is chromosome 11.
Chromosome?
11. 3 is triad is pituitary tumors, pancreatic tumors, and parathyroid neoplasm.
Parathyroid, pancreas, and pituitary.
Yeah.
Can you specify it?
In this case, it's prolactinoma. And parathyroid and pancreas is insulinoma.
Insulinoma is there
Okay,
in this.
fourth one?
Pancreatic neuroendocrine. And D is parathyroid. Most common. E most common cause of death is the pancreatic neuroendocrine tumor.
Pancreatic?
Neuroendocrine tumor.
Neuroendocrine tumor. Can you just D? We didn't get it properly. D.
Most common feature is parathyroid lesion, ma'am. Parathyroid tumor.
Parathyroid.
Yes.
So you are telling only the hormone.
Parathyroid tumor, ma'am. In the most common feature of MEN1 is parathyroid tumor.
See, you're mentioning the parathyroid.
Adenoma.
Parathyroid adenoma. Can you be little bit be specific?
Sure.
Till 30 more seconds is there.
Parathyroid tumor which causes hyperparathyroidism, parathyroid carcinoma.
Okay, 20 more seconds. So can you repeat once more your answers?
Okay,
First one is
Menon syndrome, chromosome
Menon
11.
syndrome.
Menon
Yes.
syndrome, chromosome 11, pituitary, pancreas, parathyroid.
Okay.
Most common is parathyroid tumor, that is parathyroid cancer, carcinoma, parathyroid adenoma, and most important cause of death is pancreatic neuroendocrine tumor.
Okay, so we'll just finish it. Okay, so please focus the answers. So first one is correct, multiple endocrine neoplasia type ME1, and you have informed it is chromosome 11, Q13 it is. Third one is a triad of parathyroid, pancreatic islets and anterior pituitary. Fourth one, you were not so specific. So the fourth one goes wrong.
Ma'am, I said.
No, you told only parathyroid. Okay?
Ma'am, I said after you said that, I said, ma'am.
Oh, you told hyper something like that. So it is not specific. Master decision is final. Fifth one is malignant tumor, often from neuroendocrine tumor. You were very specific.
Ma'am, I
Master
said
decision is final.
Ma'am, you can check the recording. I said primary hyperparathyroidism. I said parathyroid tumor causing primary hyperparathyroidism. Can you please verify and get back to us, ma'am? Because
yeah, please wait.
Yes, ma'am.
Please wait. Okay, fourth is also correct. So getting a jackpot. Okay, 5 entries are correct. We'll move on to the second set of questions. A 33-year-old woman presented with increasing shortness of breath, orthopnea, paroxysmal nocturnal dyspnea, and increasing lower limb edema. She also has complaints of unintentional weight loss, heat intolerance, diarrhea, abdominal pain, and palpitation. Past history of obesity and mild asthma is there. Lab diagnosis reveals on ultrasound hypervascular thyroid gland. Thyroid function test reveal FT4 2.6 nanogram per deciliter, FT3 520 picograms, and echocardiogram reveal severe dilated LV ejection fraction of 10 to 15%. So the histopathological feature is projected there. Please find it. And questions for reflection. Identify the histological feature. Second question, what additional investigations will you likely to do to confirm your diagnosis? Third one, what is the above clinical condition known as? Fourth one, what is job-based jaw disease? Fifth one is, what is ascitoxicosis? So, are you ready? Yes, time starts now. Berlin team.
appearance of follicles.
Ma'am, okay.
Yes, are you ready?
Yes, ma'am.
First question.
Yes, ma'am. Number one, it is scalloped margins of the follicles with colloid.
Scalloping of colloid.
Yes. Additional investigation you can order for TSH, thyroid scintigraphy.
Thyroid?
Thyroid scintigraphy, TSH levels.
Scintigraphy.
And TSH levels. And above clinical condition, Graves' disease, thyrotoxicosis.
Third question answer, thyroid.
Thyrotoxicosis, Graves' disease.
Okay, fourth one.
George
Basido is if you give iodine, then thyroid hormone production increases.
Overactivation.
Okay, fifth one.
Hashimotosis is in Hashimoto's disease, which is normally hypothyroidism. In the initial stages, there is exhaustion of the already present thyroid hormone, so there is a transient hyperthyroid state. So there is a thyrotoxic excess followed by hypothyroidism. That is
the initial phase is called hashimotosis.
Okay, you have 10 more seconds.
We got all our answers, ma'am. Hashimotosis, colored margins. Additional is thyroid scintigraphy, TSH profile. Thyroglobulin, Graves' disease, George Basido is increased iodine, increased
Okay. Okay, time is up. So please focus on the answers, please. Yes, first one is absolutely correct. Scalloping of colloid, papillary hyperplasia. Second one, scintigraphy you told. Yeah, correct. Third one you told thyrotoxicosis, thyroid storm. Fourth one is excess of thyroid hormones or iodine. That's also correct. Fifth one is exhaustion. You mentioned that word. Yes. All five are correct. Okay. Thank you, Berlin team.
Ma'am,
yes.
The second one is scintigraphy, it's receptor antibodies. Scintigraphy is for the uptake.
So, that is also a relevant assay, right?
No. The investigation of choice is receptor
Please wait.
antibodies, right?
The other team, please wait.
Investigation of choice. Question was
The other teams, please wait. Quizmaster decision is final. They have answered scintigraphy. All five is. So half of is correct. Okay. So partially it is correct. Second question, partially it is correct. Okay. Partially it is correct. Thank you team. Thank you Rio team for coming up. Thank you. Okay, we'll move on to the last team. Tokyo, are you ready, Tokyo? Please respond to us. Tokyo?
Yes, ma'am.
I can see only two of you in light and third one in dark. You can put a curtain behind, no, so that it will be visible. That's okay, we'll start. So, what do you want to choose? Only two is left, one is. Tokyo, what do you want to choose?
Hulk.
Hulk is already taken, ma.
Which is remaining, ma'am?
Bat is remaining.
Batman.
Batman and Spider-Man are remaining. You want to be a bat or Spider-Man? Batman. Okay. So, you just go on with the question. Please focus. A 63-year-old male was admitted to a hospital with anorexia, generalized weakness and melena that began 3 days prior to admission. The patient had been admitted to the emergency room 3 months prior due to nausea and vomiting. The serum sodium level was 114 milliequivalents per liter. Osmolality was 250 milliosmoles per kg and uric acid was 2.9 milligram per deciliter. Tests revealed urine osmolality to be 150 milliosmoles per kg. He was subsequently discharged after his symptoms subsided and the sodium levels were restored to 122 following an infusion of 3% saline. Question starts now. What is your diagnosis? Name the drugs used for this condition and which group does they belong? Can lithium be used to treat the above condition? Justify your answer. What is the safety limit while correcting hyponatremia to avoid neurological sequelae? And identify the Barter and Schwartz criteria for diagnosing above disease. Yes. Are you ready? Tokyo, the time starts now.
The diagnosis is SIADH. The drugs used are
Second question.
Baptins.
Second question is tolvaptan, conivaptan belongs to vaptans.
Okay. Third question.
Lithium can be used because it causes diabetes insipidus, the opposite of the SIADH. And the safety limit.
Safety limit is 0.5 to 1 milliequivalent per liter per hour.
What is the safety limit while correcting hyponatremia?
0.5 to 1 milliequivalent per
liter per hour.
So you can attempt. Can you attempt fifth question?
Decreased serum sodium and ADH வந்து இதுதான கஷ்டம் இதெல்லாம் உள்ள நிறைய
Increased plasma
increased
osmolarity.
plasma osmolarity.
Please be specific. Be specific. The criteria is very specific.
Hypotonic hyponatremia.
No, Barker and Schwartz criteria. Be specific.
Osmolarity sodium.
Euvolemic hyponatremia.
So you have to be specific for your correct points. Fourth and fifth, please. Fourth and fifth question. Yes, time is running. 50 seconds more. You have to summarize it at the last.
Urine osmolarity வந்து decreased.
Yes, still 40 seconds more.
Sodium decreased, plasma osmolarity increased,
Urine osmolarity decreased.
Please try the fourth and fifth question.
Fourth question is 0.5 to 1 milliequivalent per liter
Okay.
per hour. And Barker and Schwartz criteria is decreased serum sodium, increased plasma osmolarity, and decreased urine osmolarity.
Please be, again you please repeat. Fifth one.
Decreased serum sodium, decreased urine osmolarity.
Increased plasma.
Okay, only 10 seconds more. Okay, please
Decreased
submit.
plasma osmolarity.
Okay, please submit it. Please submit it.
Yes, ma'am.
First one.
SIADH.
Okay.
Second is vaptans, conivaptan, tolvaptan.
Okay.
Yes, lithium can be used because it causes
Okay.
diabetes.
Fourth one, 1 milliequivalent.
And the 0.5 to 1 milliequivalent.
Okay.
Fifth one is decreased serum sodium.
Okay. So time ends now. We'll focus on the answers. Please. Yes, your first one is correct. SIADH. Vaptans is correct. Third one is also correct. Fourth one is wrong. Fifth one, half of it is correct.
Ma'am, fourth one is we said per hour, ma'am, not over first 24 or 40.
No, we can't.
We said per hour, milliequivalent per liter per hour. Each hour we said.
Fourth one.
Yeah.
Fourth one is correct. Yeah, your fortune enough to get a correct response. Okay, fifth one.
Ma'am, but they said
Ma'am, half of
0.3 to 1. It is
0.5 to 1.
So but it should be the cutoff is 10 to 12 milliequivalent per liter in 24 hours. That means it should be like 0.4 to 0.5, not 0.5 to 1. 0.5 to 1 means it can go up to 24 milliequivalent. That is wrong.
Please wait. Please wait. We have our own expert team. Okay, we have our own expert team. We'll check with our expert team. Because the range will be different. Fourth is wrong. Fifth one, half of it is correct. Fifth one, half. Okay, so Quizmaster's decision. Fourth one is wrong. Fifth one is half of it is correct. Okay. So we'll move on to the next set, which is the last question for this round. A 32-year-old male presented to the OPD with complaints of 2 episodes of vomiting, abdominal pain associated with giddiness and generalized weakness for the past 5 to 6 days. No history of fever. On examination, hyperpigmentation was noted. The elbows, knees, lips and oral mucosa. Investigation revealed serum cortisol levels 0.5, 0.59 microgram per deciliter. Plasma ACTH 1250 picograms per ml. CT abdomen shows thinning of bilateral adrenal gland without calcification. So, what is your diagnosis? Mention the other name for this clinical condition. List the causes. What is the confirmatory lab investigation in the above condition? What is the line of management? Yes. Tokyo team. Time started.
I can
Are you ready?
The diagnosis is adrenal insufficiency.
Adrenal insufficiency.
Second question is Addison's.
Second, what is the diagnosis? The first question. What is the other name?
Addison syndrome. Addison disease. And the other name is adrenal insufficiency. The causes are autoimmune adrenalitis, TB, bleeding, any inflammation or infiltration.
Yes, continue.
And confirmatory lab investigation is ACTH stimulation test. Management is hydrocortisone given as 10 milligram, 10 milligram, and then 5 milligram. It's 10 milligram per meter square.
So, is it over for you? Want to summarize it?
The diagnosis is Addison's disease. It is also known as adrenal insufficiency. The causes
team Denver team. You're not on the
Yes, ma'am. Yes, ma'am. We lost the connection, ma'am. Now only we are reaching.
Yeah. We want to be connected.
Yes, ma'am.
Yeah. Thank you. 3.
Autoimmune disease, TB, bleeding, any infection or infections.
Okay. Fourth one.
ACTH stimulation test.
ACTH
stimulation. Hydrocortisone 10 milligram per meter square.
Okay. Shall we focus the answers? Till 30 seconds more. Want to wait?
Okay.
Denver. Only I can see 2 faces. Where is the other one? I want to see the other chap also.
He just went to the washroom. He will be coming.
Yeah. Hi. Yes. Time is up for the Tokyo team. The last question for this great round. Is the case? Yes. First one is Addison disease. Second one is hypoadrenalism. You're correct. Third one, you mentioned TB, autoimmune diseases. Fourth one, ACTH stimulation test. Fifth one, she mentioned all the glucocorticoid replacement therapy. Yes, you get full marks for all the questions. Thank you all the teams, Berlin, Tokyo, Nairobi, Rio and Denver for your active participation and active stimulation for your brain.
Hello.
Thank you so much.
Hello. Yes, ma'am.
Yes.
Ma'am, we have shared a reference regarding our question, regarding our set 1 question which we got.
Please wait, we are completing the 5th one. We'll just get it back. Yeah, we'll give you some time. So, there is some queries from the Denver. Yes, please open it up.
Yes, ma'am. Regarding the mutations that are causative mutations of Kalman syndrome and regarding the treatment, ma'am, we have shared an.
It's correct
Yes,
for
ma'am.
you. It's correct.
Okay,
Decision has been given correct. Okay, Denver, got it?
And the treatment also, ma'am, because there are two lines of management. In first, we for fertility we need this pulsatile GnRH therapy. After that, only we can resume the cycles. That is hormone replacement therapy. So we had mentioned both.
So decision is by the one has been approved. We have to wait for some team, for the referee team to give you the answers. Full marks. Okay, decision is final. You get the full marks for the 5th question also. Pulsatile GnRH followed by cyclical hormone therapy. Okay, got it. So outside was a great case scenario. So let me end the session here. Thank you, my dear team participants from all over the India for participating in this quiz, Icarus quiz. Thank you so much. Please, scoreboard, please. Yes, we'll wait for a minute. Berlin 95 points, Tokyo 85 points, Nairobi 80 points, Rio 75 points and Denver 80 points. So total score, Denver is 160 so far and 145 for Tokyo and Rio, followed by Nairobi with 140 points and Berlin is scoring 125 points.
Excuse me, ma'am. Ma'am, I think Rio should get 80 points since half and half of the 2 questions in the second part were deducted. And first question we had 1 wrong.
So one at a time, we are not hearing you properly.
The first question in the first part we had 1 wrong. That makes 10 marks less. And in the second part we have half and half of 2 questions wrong. That makes like 10 marks. 10 marks.
Just wait. totally. There is one request from the technical team. While you're answering, all the three must be visible on our camera. Otherwise, you will be losing 5 marks for the particular question. Particularly Rio team, you are missing on the particular scenario. So please don't repeat it for round 4 or round 5. Please, whatever, we have got several technical teams here working up. Please, so we don't have an artificial intelligence here. We don't have an artificial intelligence. Please cooperate with us. Okay? Please, it's not only for Rio, it's all for all the teams. If you cannot make it, you can please sit one behind the other so that it will be visible for us. Okay?
Ma'am.
So, yes, Denver team.
Team Denver, in the round 3, we got 85 points, ma'am. Like, first question we got 40 and second question we got 45. You told like pelvic ultrasound we didn't say, but hormonal assays we said. So, you told to give 5 marks for that. They didn't add in the total, ma'am.
They're checking it up. Give us few minutes.
Yes, ma'am.
But please be visible. All the three should be visible on the camera.
Autosomal dominant form.
You want a break? We'll give you 2 to 3 minutes break.
Excuse me, ma'am.
Yes, Nairobi.
Ma'am, the question for Team Denver had autosomal dominant Kalman syndrome.
Not audible, ma'am. Not audible, doctor.
Ma'am, the question of Kalman syndrome for Team Denver, ma'am, it had autosomal dominant Kalman syndrome. So, ma'am, in that mutation cannot be Cal1, it has to be FGFR1.
Cal1 is X-linked.
We have given half of it. We have given half the marks to you.
Okay, ma'am.
Okay. Denver, they are requesting something that is pelvic ultrasound and the hormone.
When anything was like that mentioned autosomal dominant or
The question they mentioned autosomal dominant, ma'am.
No, you were asking for the particular pelvic ultrasound and this one hormonal assays. You answered hormonal assays, but not the pelvic ultrasound. They are referring it. Please wait. Hello teams, if you want 3 to 5 minutes break, you can just break and come back for the 4th and 5th seat rounds so that we will not give you much more time later. So already we are running short of time. We'll give you 5 minutes break. Okay? 5 minutes break. Denver, Rio is there. Nairobi and Tokyo, are you back? Yeah. Yes. Nairobi, one more. Yeah, Tokyo, I can see all the three. So the final score is that Denver, we have already given you the points and it amounts to 80. Okay, we have considered all and we have given the same marks for all the suggestions you have given also. Okay, so Denver is 160 points, Rio 150, Nairobi 140, Tokyo 145 and Berlin 125. So all the five teams are back. So this is the final scoreboard. We'll go on to the round 4. Thank you.
Thank you, ma'am, for this brainstorming session. I now request Dr. Shanma, ma'am, to felicitate Dr. Parimala, ma'am.
The fourth and fifth team. Fifth round.
Now, let's get started with the next round. Hot seat. Teacher is full of passion and all the depth and applications to go with the topics. She is so creative and passionate about our teaching subject and communicate ideas and unique life lessons. She is none other than Dr. E. Sharma ma'am from Obstetric and Gynecology Department. She completed her UG from Government Stanley Medical College and MS in OG from Government Calicut Medical College, Kerala.
Hello, are we audible?
Am I
Yes, ma'am.
audible? Shall we start?
Yes.
Shall we start, guys? Okay. Unmute yourself and please.
Yes, ma'am.
Yes, ma'am.
Start, okay? So I'm Dr. Sharma from Department of Obstetrics and Gynecology to host this next interesting round, hot seat. Okay, I'm warning you again. Marks will be given only if all three of you are visible. Okay, your marks will be reduced if you're not completely visible. Okay, the rules of this rounds. So totally each team will be given 4 questions. All questions are MCQ type. Okay, you have one lifeline, that is 50-50, which can be used only once. That is 2 options will be removed. Okay, so correct answer for the first question you will be given 5 points, and for second question it's 10 points, third question it's 15, and for fourth question it's 20. So if you answer all the questions, the total points is 50 points. Okay, if after one wrong answer your lifeline cannot be used for the next question. Okay, if the second wrong question is given, then the team is completely eliminated from this round. If the following answer is correct, then your lifeline is regained. Okay, you understand? Suppose your first answer is wrong, your lifeline will be removed. The next question you cannot use a lifeline. If you answer the second question correctly, it is regained. You can use a lifeline for the third question. Okay. Any doubt, guys? So totally maximum of 15 seconds for each question, not more than 50 seconds. Okay. Any doubt in the rules? It's very simple MCQs only. Shall we start? Any doubts? Shall we start? Teammates, shall we start? Shall we start? You have any doubts regarding the rules? We'll be starting with the 4th team, Team Rio.
Yes, ma'am.
We'll start?
Yes, ma'am.
Yes, you can choose any one number. Okay, 2. So your first question, the most common cause of Waterhouse-Friderichsen syndrome is
Meningococemia.
I can't get you.
Meningococemia, option C.
Okay, are you sure? Can we lock it?
Yeah.
Yes, you're right. That is the right answer. Moving on to the next question. Following are the muscular support of uterus except.
The question is different, ma'am.
Sorry, regarding pituitary gland, all of the following statements are correct except it lies in the cellular
It is supplied by branches of middle meningeal
source. It is supplied by branches.
Third is incorrect. It is supplied by branches of middle meningeal artery.
Okay, that is your answer. We lock it? Yeah, that's the right answer. It is not supplied by the middle meningeal artery. Supplied from internal carotid artery. Okay. Moving on to the next question. Which of the following is not an imaging feature of cortical carcinoma? A size more than 4 centimeter, irregular with nuclear margins, less than 50% of washouts of contrast, and hypointense on MRI. Your 50 seconds.
Lifeline.
Okay. Option is either D or A. It's not C or B.
Either A or D.
It's
Either
D.
A or D.
Hypointensive.
Are you sure?
Yes.
Okay, and that's the right answer also. Okay, next. The last question. Spermicidal jelly acts through which mechanism? Acrosomal enzymes, cervical enzyme alternation, disruption of cell membrane, inhibition of glucose uptake by sperms. $30 more. Come on, all three should be visible. Rio team, Rio.
Disruption of cell membrane.
Sure?
Yeah.
And yes, that's the right answer. So you get a total of 50 points. Okay. Well done. So moving on to the next team. Fifth team, that is Team Denver. Team Denver. Yes, you
One.
One. Okay, all three should be visible, guys. So, true about pseudo-hypoparathyroidism. Increased calcium, decreased phosphate, no endogen resistance to FH or LH, heterotrophic calcification. True about pseudo-hypoparathyroidism. 35 seconds left.
Hello?
Yes?
It's heterotrophic cultivation.
Yes, that's the right answer. Okay. Good. Moving on to the next question. A 62-year-old woman who is a known case of type 2 diabetes mellitus is on medication. On examination, there is knuckle pigmentation. Which drug causes this condition? Knuckle pigmentation. And your options are rosiglitazone, acarbose, metformin, and glycoside.
Hello?
Yes.
Metformin, vitamin B12 deficiency.
Yes, because of the lactic vitamin B12 deficiency. Okay, next question. Which one of the following is a fourth generation progesterone in oral contraceptive pills? Norethindrone, drospirenone, desogestrel, norgestrel. Fourth generation progesterones.
Drospirenone.
Yes, you're right. And the last question. ACTH binds to which of the following receptors on the cell membrane of adrenal cortex for enhancing the conversion of cholesterol to pregnenolone?
50-50.
Okay. It's either B or D.
D or B.
B or D.
2 we can say. 4. 4 we can say. No. 4 we can say. 2 we can say. Yeah. 2 will say. 4 will say.
Come on, guys, you have only 15 seconds.
2 or 4. MC2. MC2, ma'am. Beta-carotene 2 receptor.
2. I mean B.
B.
Yeah. And that's the right answer. You get full points. Okay. You guessed it and you're so happy. Okay, moving on to Team Berlin.
3.
Okay. 3. All three of you, please focus only on the camera, okay? Okay, your first question. What is the composition of FECSI? Lactic acid, ascorbic acid, potassium bitartrate, ascorbic acid, citric acid, calcium bitartrate, lactic acid, citric acid, potassium bitartrate, ascorbic acid, lactic acid, and calcium bitartrate. 30 seconds.
50-50.
Okay, it is either A or D.
A or B?
A or?
D.
First option.
A or D?
A.
Okay, and that's and the right answer is
Wait,
We
what?
got
You said
Did
it's
you
A
say
or
it
no?
again?
Yes, sorry. We'll change this. We'll go to the next question. We'll change this. Next question. The most common cause of midline cyst in the neck is a degenerated lipoma, cystic degeneration of thyroid adenoma, thyroglossal duct cyst, brachial cleft cyst.
C. Thyroglossal duct cyst.
Yes, that's the right answer. Moving on to the next question. Field defects are seen in patients with pituitary tumor of size, tumor less than 5 mm in diameter, tumor of 5 mm in diameter, tumor of less than 10 mm in diameter, tumor more than 10 mm in diameter.
Tumor more than 10 millimeter diameter. D.
Yes, and that's the right answer. So the third question for you all. Averbach chemotherapy protocol for pheochromocytoma includes all except dacarbazine, vincristine, cyclophosphamide, cisplatin.
Cisplatin is not there. D.
Yes, that's the right answer. But 1 second, please. So we'll be giving you mark for that first question, okay? Pexi, no controversies. Next is Team Tokyo. You can choose your number. Team Tokyo.
Which one is not chosen?
I think 4, 5, 6. 4, 5, 6.
Five.
So your first question, aldosterone deficiency causes cardiac toxicity, hypokalemia, hypocalcemia, muscle weakness.
The muscle weakness.
30 seconds left.
Lifeline.
Okay, it's either A or C. Either A or C.
C.
Sorry, cardiac toxicity is the right answer. You can't be using lifeline anymore, okay? So DNA's mutation is associated with malignancy of which cells? DNA's mutation. Lactotropes,
Somatotropes.
thyrotropes and none.
Somatotropes.
Yes, that's the right answer. Third question. Fimbrectomy is also known as Pomeroy's technique, Uchida's tech procedure, Irving's procedure, Thorner's procedures. Fimbrectomy. You don't have a lifeline.
Kroner's procedure.
Are you sure?
Yes, Kroner's procedure.
Yes, that's the right answer also. The last question. A 58-year-old woman was recently diagnosed with type 2 diabetes mellitus and she had an acute on chronic kidney disease and started with metformin therapy. Her estimated glomerular filtration rate was 30 millimeter per 1.73 meter square. Which of the following is not true regarding further management of this lady? Either metformin should be continued, metformin should not be reduced, does not.
Metformin should be continued.
Are you sure?
Yes, ma'am. Yeah.
Yes. So metformin should not be continued ideally because of the lactic acidosis. Okay, so you totally get 3 questions right. 40 points. Okay. Team Tokyo. Okay, the last team, Team Nairobi. You have either 4 or 6 left.
4.
4. Your first question, which of the following is not a sign of thyroid eye or ophthalmopathy? retraction of upper eyelids, frequent blinking, proptosis, restrictive myopathy.
Frequent blinking.
Yes, and that's the right answer also. Your second question.
डिस्कस करके करेंगे आंसर जल्दीबाजी में नहीं
3B.
हर
Your
क्वेश्चन
next question. In which condition cyst trunk operation is done? Thymic aplasia, hypoparathyroidism, thyroglossal cyst, hyperparathyroidism.
Ma'am, it's thyroglossal cyst.
Yes, and that's the right answer too. The next question. Clinical manifestation of hypoparathyroidism include pathological fracture, cataract, jaundice, peptic ulcer. Hypoparathyroidism.
हाइपर में होता है पैथोलॉजिकल पैप्टिक कल्चर एंड
कैटरैक्ट होगा ना हाइपोकैल्सिमिया 50-50 कर लेते हैं मैम 50-50
Okay, your answer is either B or C.
Ma'am, B or C?
Ma'am,
cataract.
Yes, and that's the right answer. And your last question. In the unilateral adrenal mass, which of the following has a maximum prevalence? Adrenocortical carcinoma, malignant pheochromocytoma, metastasis, adrenal neuroblastoma. Can't use your lifeline.
कार्सिनोमा तो नहीं है malignant pheochromocytoma
25 seconds left.
नहीं मेट कर देते हैं मैम मेटास्टेसिस सी
What? You told something?
Metastasis.
I'm sorry, it's adrenocortical carcinoma is the right answer. So you'll be getting 30 points for this round. Okay. Right. So thank you guys. We'll be letting you know your score now.
guys, you can switch on your camera. And for Team Berlin, for whom we gave an answer no, we are sorry from our side for giving you the wrong options. So it's not fair to give full mark no. So we are instead asking another question. Okay, you will be given 5 marks because it's the first question. You can even use your 50-50 lifetime if you want. Okay, just a single question. Okay, and it's from 6th. Okay, what forms Riddle's triangle? It's superior thyroid artery, carotid artery at base and trachea medially, inferior thyroid artery, carotid artery medially and trachea laterally, inferior thyroid artery, carotid artery at base, recurrent laryngeal nerve, superior thyroid artery, carotid artery laterally and recurrent laryngeal nerve.
Lifeline 50-50.
Okay, it's either C or A.
C.
Yes, that's the right answer. So we'll give you 5 marks. Okay. Fine. Round, Berlin team gets 50 points, Tokyo 45, Nairobi 30, Rio team gets 50 and Denver team gets 50. And total, it's Denver team which is leading with 210 points, followed by Rio team 200 and Tokyo 190, Berlin 175 and Nairobi 170. Okay, any queries? Fine. Okay. Thank you guys and all the very best.
Thank you, ma'am. Now I request Dr. Tamarai Selvi ma'am to felicitate Dr. Shanma ma'am. A 10 minutes break is given to the participants before starting the next round. Round 5. Don't blink. She has steadfast diligence to teaching and for making us all comfortable with approachable personal demeanor. She makes everything easy by giving inspirational words. She is none other than Dr. Tamarai Selvi ma'am. She completed her UG from Government Chengalpattu Medical College and MD from Karpaga Vinayaka Institute of Medical Science and Research. She has done 7 international, 1 national and 1 state journals.
We'll see. So, good afternoon. Please ensure the audibility and Team Berlin, your video is not visual. Yeah, I think we can all see all of this and it's already going to be a lunchtime and make all the blood supply to reach your brain so that your answers will be coming steadfast. So, good afternoon. I think you would have heard about my introduction. Is it audible? Please ensure whether you are able to hear me. Team Denver, can you hear us?
Yes, ma'am. Yes, ma'am.
Yes, ma'am. Team Berlin?
Yes,
we are
ma'am.
not able to hear you. Team Berlin?
Hello, ma'am.
Team
Yes, ma'am. Yes, ma'am.
Hi. Team Tokyo? Hi. Yes. Then Nairobi?
Yes, ma'am, you're audible.
Yes, fine. Then Rio. And how about Tokyo? I could see your hi, but I want your voice also, ma'am. So,
Yes, ma'am. We are done.
yes, thank you. So, we are starting right now shortly. So, we'll begin with Team Denver. These are all the rules. You can have a look onto it. Each team will be given 10 questions. You have a total time limit of 100 seconds. All the 10 questions will be displayed in front of you, but please remember, we'll be asking you one by one and you are expected to answer each question. But within 100 seconds, even if you miss any of the question, you can go back and answer that question. Is that clear? There is no negative marking over here. And you know the last word, that whose decision is final, is you have been hearing all throughout. So that is going to be final and all the very best. Anything else, ma'am?
So we can only read the questions by ourselves, right?
Sorry, I cannot hear you.
Whether all the questions will be displaying.
All the questions
Whether
you
all the
can
questions
see.
will be.
You can see all the questions in front of your screen. We'll be asking
Then
you
we
one
can
by.
say the number and say the answer, ma'am.
Yeah, that is actually you can say it, but once all the 10 questions are asked by us, if in case you can come out with the answers. Because suppose in case we're missing out the numbers, that will be an issue. So we'll be asking you one by one questions. Try to answer all the questions. In case you are missing out any of the questions, you can come back and give us the answer. Is that
Ma'am,
clear?
can we tell the question number and just the answer, ma'am? Because when
that is what actually I'm telling about. In case if all of you want it to be that way, I think that can also be done. If all the teams are agreeing to that, you want to say, I mean, you will say the question number first and you will give the answer and we'll verify it. Within 100 seconds, you will give us the right answers. If that is fine with all the teams, then it is okay with us.
Yes, ma'am.
I want all the teams.
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Yes.
We'll begin with one by one. How about Denver?
Yes, ma'am. We'll say the number and then tell the answer.
Berlin?
Yes, ma'am.
Yes, ma'am.
Tokyo?
Yes, ma'am.
Then Nairobi
Yes, ma'am.
and Rio.
Yes, ma'am.
So when all the teams have agreed to it, so that's final. We'll display all the questions. You can give us the question number and the answer for it. Within 100 seconds, you can answer all the questions and finalize the answers and give us. We'll give you what is your score. Is that fine with you? So we'll begin with Team Denver. Please choose your favorite team.
CSK.
CSK, fine. Yeah, it is chosen and I hope you can see the questions on the board. Is it visible? And the
Yes,
timer has started.
One is Tourette syndrome.
Sorry. Yeah.
Tourette syndrome, 2 pass, 3
Transthyretin.
4 is
So pass.
cytotoxic antibiotics.
People's triad, insulinoma,
Heading bodies, posterior pituitary, characteristic sign, slit,
Sorry,
collared slit sign, decreased levothyroid undergoing estrogen increased.
This is that D.
Diethyl stilbestrol, question number 10.
Okay, can you repeat the answers one more time?
Tell them.
First one is Tate syndrome. Second one, BRVO.
Make it fast, ma.
CRVO, transthyretin.
Then you go. We will go with diabetes.
Thyroid ophthalmopathy and cytotoxic antibody pass, Whipple-Stride insulinoma, posterior pituitary, characteristic collar slit sign, decreased levothyroid. 10 is diethyl stilbestrol, decreased levothyroid, undergoing which therapy? Coronary artery disease.
Time up, ma. Time up. We'll come out with your answers. Ma, you have noted down? Can you pass the mic? Mute them. So welcome back, Team Denver. I think you can hear me. Team Denver has answered 7 questions right, and you get 70 points out of it. Now we'll go to the next team. I'm sorry, I said Team Denver has completed their round. They have answered 7 questions right, and you get 70 scores out of it. Then we'll move to the next team. It's the chance for Team Berlin. Team Berlin? Yes. Who's your team?
Mumbai Indians.
Mumbai Indians. And you be very slow in telling it, Ma. Yeah, one by one, please. Yeah, continue.
Zerbolan pattern pheochromocytoma.
Ma, you tell in an order, Ma. Number 1, 2, 3.
Pheochromocytoma.
7 is mitoten. 4 is pheochromocytoma.
5
5 is hyperparathyroidism.
8 is tuberculosis.
1 is mesonephric duct.
One is what?
Mesonephric duct or Wolffian duct.
9 is Modi 3.
Maybe due to cellular.
10 it may be due to ANP. ANP could be
Or
the cause.
pressure arteriosus.
One by one, please.
10. Two reasons are there. One is ANP or
No, we don't want reasons, ma. Your answer final.
ANP.
Okay, okay. Then.
What's left?
What is your answer for 5? You are given answer for 5, no?
Hyperparathyroidism.
So you are yet to answer 2, 3 and 6.
10, number 2.
You are yet to answer 2, 3 and 6. Only 7 seconds.
2 10 to 15 microgram per kg per day.
Okay.
Diabetic macular edema. Glutazones.
Time up, ma. Time up. Time up. You answered 8 questions.
The 6 on there.
Yeah. Please tell answers.
Ma. So you have attempted 8 questions and 7 are right among them. So team Berlin also gets 70 scores. Okay.
Can you see the answers, ma'am?
Sorry, ma.
Can you see the answers?
We'll make it arrangement for that. Let us finish the round first, ma, because the connectivity issue will be there. We'll finish off the rounds first, then you will have a chance to look at it.
Okay.
If
Which
possible.
is the wrong answer, ma'am?
You are given the 5th one, which is a wrong one, ma. So next team, we'll go to the next team, Team Tokyo.
Delhi Capitals.
Delhi Capitals.
Most sensitive test.
Start, ma.
Fourth. Who is fourth coach? And third medullary thyroid carcinoma. Fourth is apathetic hyperthyroidism. Sixth is follicular carcinoma. 10 is bevacizumab. 9 papillary carcinoma. 8 Cowden syndrome.
You are yet to answer question 1, 5 and 7. Question 1, 5 and 7 are yet to be answered.
7 is Whipple's procedure. Serum first is C-peptide levels.
One more question. You are yet to answer.
Fifth one is DX and SAF and DX.
Sorry?
The fifth one is SAF and DX.
SAF and
DX. SAF or SAF? SF and DX. DAX. DAX.
Okay, ma. Time up. So Team Tokyo, out of the 10 questions, 8 questions are right, so you get 80 score. So Team Tokyo gets 80 scores. It's time for the next team, Team Nairobi, to come over and select your team.
Ma'am, RCB.
RCB. Yes, okay. Time starts.
Ma'am, one is Linagliptin. 2 क्या हम 2 is tamoxifen. 3 का क्या 4 का क्या cardiac palpitations tachycardia. हाँ 4th is tachycardia. Billings method is fertility, वो temperature वाला cervical mucus. Fifth is cervical mucus.
Ma'am, Billings method is cervical mucus thickness for
What is triadosomatostatinoma? Diabetes and diarrhea and
presence of peripheral access tentacular cells of pseudocytoma positive for which marker?
S100.
7 is S100.
Panhypopituitarism.
8 is panhypopituitarism. Urine test is to rule out. अच्छा. 9 is galactosemia. है ना? 9 is galactosemia.
हाँ.
9 is galactosemia.
Yet to answer 3, 6 and 10.
Yes, ma'am.
3, 6 and 10.
ECTH dependent. Ma'am, 10 is transphenoidal resection of pituitary. 3 का बता.
Diabetic papillopathy. Papilledema.
Ma'am, 3 is papilledema.
Ma'am, 6 is diarrhea, diabetes mellitus, and ulcer, peptic ulcer.
The sixth one, can you please repeat it?
Ma'am, diarrhea, diabetes mellitus, and peptic ulcer.
Sorry, ma, I can hear about diarrhea, diabetes mellitus then.
Ma'am, ulcer, peptic ulcer.
Okay. One question. So team Nairobi, you have answered 9 questions correct and you get 90 score. Okay. So we'll go on. I think you have heard me. You have answered 9 questions correct and you got 90 score. Now time for the last team, Team Rio, to come up with your favorite IPL team.
Yes. Kolkata Knight Riders.
Kolkata Knight Riders, yes.
Kolkata Knight Riders.
Yes, yes, yes.
Ma'am, 10th is bitemporal hemianopia. Tumor that follows rule of 10 is pheochromocytoma. Posterior glomus.
Please be loud, ma. We are not able to hear you properly.
One is question number 1 is conivectin. Number 8 is pheochromocytoma. Number 10 is bitemporal hemianopia.
sulfonamides. First one is sulfonamides. Aldosterone synthesis.
Ma, you have answered only 3 questions, 1, 8 and 10.
CYP11AB2. CYP11B2 aldosterone synthesis gene. CYP11B2.
Sorry, we are not able to hear you properly, ma. 1, 8 and 10.
CYP11B2 gene. CYP11B2 for aldosterone synthase. First one is sulfonamides. Second one is CYP11B2 gene. One is pheochromocytoma. Classical measurement field abnormalities is bitemporal hemianopia. Treatment of choice for osteosarcoma phylloides is mastectomy. Glioma cell and peripheral chemoreceptors.
I think it's time up. Time up, please. Team Rio is there. We are not able to see your video. Team Rio. Yes, you have answered 5 questions right and you get 50 points. Okay. So to sum up, actually Denver has scored 70, Berlin 70, Tokyo 80, Nairobi 90 and Rio 50. So this is your score for your rapid fire. I think it's clear and we'll summarize your scores and tell you recently. Before that, congratulations to all the participants from all over the place. You are here, sparing your lunch time. So all the very best and have a successful career ahead. Have a good time. Bye.
Thank you, ma'am, for the meteoric session. I request Dr. Punita ma'am to felicitate Dr. Thamare Selvai ma'am. Now I request Dr. Punita ma'am to announce the winners of today's event. Okay, all the teams, can you all keep your video on? All the 5 teams? Team Berlin, Tokyo. So please keep your video on. Should we wait or we can announce the result? They are not coming on. We'll announce. Okay. So before announcing the results, I'd like to congratulate the organizing team. So they have been working for past 2-3 months, I think. Day and night they are putting their efforts and they have done it really fantastically. Yeah, they have brought out very well. That too on online platform. I think this is first of this kind, like in Meenakshi, I think. Online quiz, conducting online quiz. Yeah, so I wish to congratulate each one of you. Okay, so let me read out the final scores. So Team Berlin, they have scored 245 points, and Team Tokyo 270, Team Nairobi 260, Team Rio 250, and Team Denver 280. Okay, so let me congratulate all the teams. You have all participated like really well, and there were only like minimal difference between the teams. But we can't give prize to all, so we are giving 2 prizes. Okay, one is winner and runner-up. I'll start with runner-up. Team Tokyo from IGMC. Vishwata, Rakesh, and Puviarasi. Okay, so Team Tokyo, you are the runner-up. Yeah. And today's winner, I think second time. Last year also you people won. Okay, congratulations, Team Jipma. Like Team Denver from Jipma, Anirban Dev, Bikash Saho, and Saravanan. Congratulations. Okay, thank you, students.
I request my co-anchor Kubra to deliver the vote of thanks.
It's amazing how two words that mean so much can seem so little. If we could show how much your presence means to us, the simple phrase of thank you would pale and diminish in the sheer enormity of gratitude we owe. At times, a light goes out and is rekindled by a spark from another person. Each of us has cause to think with deep gratitude of those who have lightened the flame within us. The time has come to express our gratitude to the persons who have kindled our life with care and affection. Now, I thank MD Sir, Dean Sir, VP Admin Dr. Mithun Sir, VP Academic Dr. Muthulakshmi Ma'am, RMO Dr. Mahendra Sir, Quiz Masters, proofreading faculty, HODs of all the departments, supporting staffs, and our badge Jennies.
Success is not final. Failure is not fatal. It is the courage to continue that counts. I would like to extend my heartily thanks to Quizmasters, participants, and my dear friends who worked tirelessly to make this event a memorable one. Thank you.